Well, everyone, thank you very much for joining us this evening. We're so glad you're here for our live webinar called the Eye-Brain Connection, hosted by Kemper Cognitive Wellness and featuring our special guest, Dr. Scott Sedlacek from the iPlace. I'm Stacy Four from Kemper, and tonight we'll be exploring the fascinating link between your vision and cognitive health. Our goal is to keep this webinar to an informative 30 to 40 minutes, leaving time to answer questions at the end. So you can just type your questions in the chat box as we go along, and we'll address them when the presentation is complete. If you're not yet familiar with our presenters, Kemper Cognitive Wellness is located in Rocky River, Ohio, and our team specializes in personalized integrative care for both brain and body. And we go beyond the traditional medicine to identify and address the root causes of your concerns rather than simply managing symptoms. We're also proud to partner in this presentation with the iPlace in Olmsted Falls, a practice committed to helping you see, look, feel, and think your best through the most advanced diagnostic and vision care technology available. So tonight, our presenters are Kristen Kemper, co-founder of Kemper Cognitive Wellness, Dr. Nate Bergman, Chief Scientific Wellness Officer from Kemper, and Dr. Scott Sedlacek, optometrist and founder of the iPlace. So let's just get started. And Kristen, can you lead us off with telling us how Kemper Cognitive Wellness came about?
Sorry.
There you go.
You may have seen or heard our commercials for both Kemper House and Kemper Cognitive Wellness, where my mother Betty says, for us, it's personal. Well, for us, this really is personal. My grandmother was diagnosed in the 80s before most people had even heard of Alzheimer's disease. And then my dad was officially diagnosed in 2012, but we saw signs long before that. So we knew we had to do something. The good news is we now know that there are many things that you can do to slow down and potentially even prevent receiving a diagnosis like my family did. But the key really is early detection. Please don't wait, take action. One way to do that, of course, is by calling Kemper Cognitive Wellness and getting tested. But did you know that your eye doctor should be a valuable resource as well? I had been getting a routine eye exam like most of you guys every year and seemed to be managing okay, but I didn't realize what I was missing until I met with Dr. Scott Sedlacek. I found his methods and commitment to early detection very inspiring and very much aligned with Kemper's mission, which is why we wanted to bring you the presentation today. So let me reintroduce Dr. Nate Bergman and Dr. Scott Sedlacek.
Thanks, Kristen. And I just want to reiterate what Stacy said at the beginning, that we're just encourage people to ask questions. That we have a question already in the Q bank, and when we're done, we'll some of those questions may be answered in time, just sort of like through the course of this interview. This is really just going to be informal. If anybody's listened to our podcast, it's sort of just like really an interview where it's a pleasure to have Scott with us here. And like I said, like Scott, there's a really kind of a big connection between the eye and the brain, and I think some people here might know it, but I think some people might not. So Scott, we'll just kind of jump right into it. Like we see at Kemper, we see a lot of people that are having cognitive issues that they know there's a problem. Somebody that cares about them might know there's a problem, but they've been often told by a primary care doctor or a neurologist, really probably a well-intentioned physician or somebody in healthcare, that they're fine and not to worry about it. And while I hope that's true, it's not always the case, especially if Alzheimer's runs in the family or there's really some kind of degenerative process at work. So, when we're talking about brain health, we're talking about the eye. Kristen brought up, she had her own experience with you and sort of a standard eye exam and then going to you. What's the problem maybe with the standard eye exam when people are just told they're fine and maybe they're just getting a glasses prescription? Where are we going wrong? Like what's kind of the news to know here?
Yeah. I would say that not only is eye health and brain health linked, but they're actually inseparable. And I really use that word and believe it. And the problem with I think is that most eye exams, at least in the past, they're focused on the optics of your eye, right? Like your focusing system,
Mm.
like the clarity of your vision. Okay. And that's great. That's what patients are there for, to maybe get their prescription so they can get glasses or contacts and see more clearly. But, in reality, a comprehensive eye exam that's different than a vision exam is it really should be a window into your overall health, and that absolutely includes your brain health. Okay. And really, every systemic condition and like the medications you take for those things can show up in the eye and also affect your brain. If you think about the retina itself, it's light receptors in the back of your eye. It receives light, right, and sends it to your brain. Okay, so the retina itself is brain tissue inside your eye. So really, the eye and the brain, they share structure and function. And about 80% of visual processing actually happens in your brain, right? So you look with your eyes, okay, but you actually see with your brain, okay. And what I find is interesting, just like Kristen, like she cares about her brain health, because of her family history, and it's a no-brainer. If you have a brain, you should care about your brain health, okay? And patients do. And I actually saw a study recently that was interesting, and it showed that of all the things that patients are worried about losing and medical conditions they might encounter over the course of their life, it was actually dementia was number one by far, and it beat out cancer, stroke, diabetes, heart disease, everything. It's dementia. Yeah, and here's the that slide that I had mentioned. So people care about this stuff, okay? But unfortunately, doctors, all medical professionals, not just eye doctors, they're not doing much about this, okay? So there's a huge gap in medical care, okay? And speaking from the eye doctor perspective, I can tell you that some eye doctors are still doing like what Kristen experienced and most everybody else on this webinar, an eyeball exam. You could drop your eyeballs off at the counter, come back later, pick them up, and there's a fence around your eye, and we can't do that anymore. Okay. And so, we have to get outside the eye and into general health, actually, to do our job as an eye doctor, which is to keep your vision. And I would say one other thing. It's interesting. People ask me why I'm so passionate about this, and you know what? It's my job. Okay, it's the oath I took as an eye doctor. All eye doctors take an oath. It's the optometric
Yeah.
oath. Okay, and it says very clearly that I will advise my patients, okay, fully and honestly, of all that will restore, maintain, and enhance their vision and general health. But that's interesting. Okay, so I do this because I care, but it's actually my job.
Yeah, right. Right. We try to, and we're both fortunate to be in jobs that we are passionate about. And I myself came from a place where I had a pretty broken brain, some pretty good cognitive impairment, really in my 30s, during some of my training and with the principles that we now use at Kemper and basic principles in functional medicine really came a long way back. These things they work, and we'll get into some examples here, other than ourselves. And just to get a little more specific now, testing, right? So you might do some tests in your office that other people do. Can you get a little bit more specific about what kind of testing seems to matter, why you do those tests, and how they might relate to the brain? The eye tests and things that you're doing that might relate to the brain as well.
Yeah, so there's two basically sort of like main types of testing. We have structural testing and functional testing. And it's really structural tests is like what most people are used to doing, where an eye doctor like looks at structure. I look at your retina, I look at your optic nerve, I look at your blood vessels. I'm looking at a picture, okay? And that's nice because we have to look at structure. And I even have the most advanced structural systems, even including like AI capabilities that no one else has. So even on the structural end, that's very important. And I even have the best equipment there. But the big difference is that most eye doctors and doctors in general aren't getting into the functional testing area yet. And that's really what people care about. Does their vision work? Okay, I can look at a pretty picture of your retina and tell you how many yellow bumps there are, but you care about, can you see or not? Does your macula work? Okay, so I have a test. It's called the AdaptDX Pro, and it's a functional test of the macula. It actually tests light receptors to see if they're working or not. And so we can actually detect something like macular degeneration about 5 years earlier with a functional test before we can actually see the damage structurally. So we can catch something much earlier when it matters more, when we can intervene and put a treatment plan in place and actually avoid that structural change, which leads to permanent vision loss. Okay, so as far as a brain health, a functional test, I have what's called the CogniView Thrive. It's a brain health screening. Okay, it's self-administered. People actually love taking it. It takes about 8 minutes, and it's a screening of memory, visual, spatial, and executive function. That's those three domains, which are very important. And I do it every year on every patient since 2018. Some populations, some patients for certain reasons, I actually do it twice a year. But patients love it. And, especially those that have a family history of macular degeneration or dementia, they want to get on the front end of these things. And so they're very interested in how they score and to be able to detect something early, like we're talking about here.
Yeah, absolutely. We also do, obviously, we do extensive cognitive testing, and we would, from our perspective, we do even things. The CogniView is a good tool. We also want to measure processing speed and cognitive flexibility and some other sort of metrics. So there's lots to measure, especially if there's a problem, especially if somebody knows that, if there's a problem, they're being told that things are normal. If
That's
obviously
why I love collaborating with you. I'm doing just a very superficial screening of brain health, which is important. And it can pick up mild cognitive impairment. But then what I do is I can work with amazing systems like what you guys have. And that's where you can really dig deep and get into much further, more important testing that's more informative and more impactful to really put the treatment plan together. But I can find them early and do my part. And that's why I love being on a collaborative care team with you guys.
Yeah, thank you for saying that. Yeah, we're excited to be working alongside here. So I also want to get into there every once in a while, usually on sort of my feeds, the things that find me in the world of prevention and the world of things that make a difference, other than so all senses make a difference. Taste, smell makes a difference. People that lose their sense of smell are at higher risk for dementia. People that lose their sense of hearing are kind of wandering into dementiaville or the possibility for it. There are a number of conditions, and maybe you can lay them out. You mentioned macular degeneration, but there are other ones, no doubt, that are sort of precursors or harbingers of dementia. Can you kind of go through some of those conditions and how you might look for those, and how you might deal with those with a patient?
Well, certainly macular degeneration, but the next probably biggest one might be cataracts. Early, people are told they have early cataracts. It's not that bad. You don't need surgery, and you just wait and see you next year, and it gets worse and worse and worse. And I guess the other one would be just something as simple as what is like an uncorrected refractive error. What that means is you have a prescription that you just don't know that has developed over a couple of years because your vision changes so slowly over time. You don't realize what you're not seeing until someone like me shows you what you're not seeing. And so just getting an eye exam to get the right prescription and then actually wear it for those activities of daily living where it's important to have it on. And so there's people who over time, they just kind of don't have eye exams anymore. They think they see good enough. And, they're really missing out on a lot of things. And also they're at risk for a fall, believe it or not. If you don't see well, you trip on a curb and you fall down and you break your hip and you're in a hospital. So not only does vision play into cognitive function, but vision is really important for overall health, overall wellness. And it's the dominant sense really of all the other ones. Sure, hearing matters and all those other ones too, but vision, I mean, it provides the brain with data that it needs for memory, decision making, problem solving. These are higher order cognitive functions that actually rely on vision mostly. Okay. So that's why, vision decline absolutely drives cognitive decline no matter what the cause. Macular degeneration, cataracts, just not wearing your glasses.
Yeah.
Yeah.
In my case, Nate, I think I told you, but I was totally overcorrected. And Dr. Scott got me set up. I mean, it's life-changing. I don't mean to be dramatic about it, but when you can see so clearly and you don't have one eye a little different and off, it's amazing.
Yeah, absolutely. That's a good point. So another interesting thing, we had a conversation a few weeks ago when we first met, or whatever, and one of the things that was brought up were that you can see changes in the eyes in people, even like younger athletes, from things like stress or even concussions, mild head injuries. Can you kind of talk about what you mean by that? How can you see changes in the eyes that reflect stress or mild head injuries? What are you actually seeing there?
Yeah, so teenagers, they're at a time in their life when, from a developmental visual standpoint, their vision's changing quite rapidly. As your body's growing, your eyes are growing, and your vision changes through your teen years quite a bit. And so that population has an eye exam every year, and a lot of them are wearing contacts because they're active and they're playing sports. So because they're a contact lens wearer, we need to look at the health of the eye, make sure the contact lenses are fitting properly and their eyes are staying healthy while wearing contacts. But in addition, that's that same group that I'll do a brain health screening on. I'm actually part of a concussion protocol team. So athletes, I don't care what age they are, you should have a baseline screening on your brain health. And so that if you do suffer an injury, we know what baseline you need to get back to return to play. But outside of concussions, to get back to your question, I found it very interesting that I test some athletes preseason and postseason, and especially in the more higher impact sports, football and lacrosse, obviously hockey. And these student athletes, they test about 10 to 15 points lower on all three domains post-season, and they never had a head injury. Okay, so we're picking up mild cognitive impairment, and it's measurable. Okay, and they never had a head injury. It's from what we call repetitive head stress, right? It's practice every day taking hits, and I believe it's low level, chronic inflammation in the brain from the sports activity and taking these hits every day. And there's an impact there. And if you think about postseason, the time of the year, I have 5 kids, they all went through school, teenagers, and that time of year, they have playoffs. They're at a very high level of anxiety. They have finals in school. They're studying. They're not rested very well. And they have a lot going on. They also have to take SATs and ACTs. And so all those things contribute to what I think is these lower scores on their brain health screening at a time when they really need to be functioning optimally, and they're not.
Yeah, so that's an interesting, we can just riff on that for a second. The concussions is sounds like, especially concussions and then stress. Just a few things. One of the things we do here, and I was just talking to our director of operations, Nick Radka, who's probably on, about the impact of sleep, right? You can, and I'm sorry to do what I call the blah blah, like we do, you can never get away from diet and exercise and sleep and stress, but you start to see, like we do it, let's say we do a QEEG, like a brain map on someone, and you could see the impact of a poor night's sleep. Like it really slows down the brain. Stress kind of does the same thing. It starts to grab, you could sort of simplify it and say it start to grab the energy away from the brain. And then a concussion, if you add that and too much alcohol or too much sugar, right, you are getting a perfect storm of inflammation, oxidative stress, and then you're starting to drain energy out of the brain, particularly the concussions, right? And then if you add that to a mix of a real neurodegenerative disease like Alzheimer's disease, where the brain may start to shrink at some point, it's a problem, right? So we had a man that came in to see us a couple months ago. He's in a profession where his vision and his executive function are extremely important. And if he was servicing you, you would want his vision and his executive function to be perfect. And he gets tested for it on a fairly regular basis. But a few years ago, he had a concussion. And he's never quite the same. And Alzheimer's runs in his family in a blood relative. And he is, he was gay, he went to the neurologist a couple years ago, you're all fine, but he is seeing this problem. We did a brain map on him. And you could see, now the brain maps don't tell you about a concussion, but if you kind of know what you're looking for, you can interpret certain findings. And I think you mentioned this at the beginning of your talk, Scott, but ironically, a lot of where the machinery, so to speak, the brain machinery for, as you know better than I, where the brain machinery is for the eye and the visual system twists through the brain and then ends up in the back in the occipital lobe. And this guy had a sort of a lit up slow areas in his occipital lobe, right? And this came as a direct result of his concussion. He says the concussion after there was a skiing accident, he was never quite the same. Fortunately, this guy's fairly young. He's in his 50s. And he's got an opportunity to really turn on. So we just started working with him. But like this idea of brain energy and concussion, and then he was also probably drinking too much, so sort of just putting fuel on the fire. And so we'll see. We started him on a few things, and I think he's the kind of guy that I think is going to get better fairly rapidly. So it's exciting. This is the kind of those things that we're really trying to prevent something inevitable or something that might be really bad from developing, like in one of his family members who developed Alzheimer's. So that's a good conversation. Okay, just a couple of other things. I'd like to get a little bit practical. Now, we do a lot of extensive lab. We do a lot of lab testing here, and maybe you can touch on the insurance piece a little bit too, because I think there's a question about that. But we're testing for things like methylation status and omegas and nutritional things and various vitamins. But from your perspective, working with someone just like eye and brain health in general, what are you recommending? What are you thinking is important? And maybe we can just have a little bit of a bit of a conversation about that piece.
Yeah, so we look at all things. There isn't any one cause of macular degeneration or cognitive decline. It's causes, and so we really have to have a multimodal strategy, and we need to look at everything. I mean, we need to look at hormones. Hormones absolutely matter. Oxidative stress, like you mentioned, and methylation. That's like in blood work. It's biochemistry. It's very important. Inflammation, certainly. Inflammation's bad for every cell in your body, including the cells in your eyes. And matter of fact, there's an inflammatory component to dry eye, which is the front of your eye doesn't create water and tears. And there's an inflammatory component to macular degeneration. So it affects the eye from the front to the back. Inflammation is bad for the eye, it's bad for the brain. Nutrition obviously matters too. So we need to look at what people are eating, maybe food sensitivity testing. And genetics, obviously, genetics matters. And genetic testing I've been doing for at least a decade. It's not new, it's just neglected. And the 2004 is when the Human Genome Project came out, so that's quite a bit ago. And there's some doctors that have never done a genetic test on a patient ever yet. And we need to be putting together personalized care plans and involve genetic information where we're able to when it's actionable. So all of these things matter. I love that you guys are into that level of depth of testing. Normally, I'll work with an MD if I can, or a functional medicine practitioner, or a point of care lab testing service who I can send a patient just to go pay out of pocket and get some testing done. But I really love having hooked up with you guys because you understand all of these things, and I can get a patient in there to be really looking deep into these tests because early detection is great, and that's a lot of what I'm looking for. That's my job, detect it early, right? But then detecting something early is only important if we put a treatment plan in place to change the outcome. Okay, so we have to do some very important testing, okay, to guide the treatment plan so that we can actually have a precise and personalized treatment plan to get the outcome we're looking for. Okay, so that's where the testing does matter. And we got to do a lot more than just your standard blood work that you might get done every year at your regular wellness physical. That's not enough. Certainly, the lifestyle issues matter, like you said, the blah, blah, blah. Okay, but the blah, blah, blah is really important. And unfortunately, those are things that people have to make choices. Okay, health is more about choice than chance. And the blah, blah, blah is choices. Okay, you have to move your body. You have to try to manage your stress. You have to get good rest, right?
Mm.
Don't drink and don't smoke. And especially the drinking. Alcohol is just unnecessary, even in little bits. It's a neurotoxin. So if you're concerned about brain health, I mean, you shouldn't be drinking alcohol. It's a no-brainer right there. Okay.
Yeah.
So the blah, blah, blah matters. And I talk about it every day to all my patients too, but I really emphasize it.
Yeah, absolutely. So, I mean, just as we wrap up here, and maybe we'll have a few minutes for questions. I see there's 5 or 6 questions coming in. Like supplements. We're Americans. We'll always take a pill over having to do the hard work. I'll raise my hand, and everybody's pretty much the same. Like in a previous conversation that we had, also like something that's mentioned a lot is like the AREDS 2 vitamin. It's super popular. You see it everywhere. I mean, I've certainly recommended it to people over the years. Like, is that a good supplement? I mean, like that's just one that's so common for the eyes, and it seems like
Yeah.
it has good things in it.
And an answer, no. It's AREDS. For people that aren't familiar, it's AREDS, Age-Related Eye Disease Study. Okay, it's a study that was done 23 years ago. Okay, scientific discovery is far outpacing doctors' ability to learn it and use it. And if we're still recommending a handful of antioxidants put together in a study, a one-size-fits-all supplement that you could buy over the counter at Drug Mart to all of our patients, I mean, we can do so much better than that. Okay, so I might say AREDS might be better than nothing. Okay, but even on the supplement end, there's so many other better supplements, like as you know, omega-3s for sure. Okay, as far as the eye goes, lutein and zeaxanthin, absolutely, probably astaxanthin as well, and anything that helps with inflammation. So maybe even curcumin, and probably vitamin D3 is a good one for most people to take for a lot of different general health conditions. But it's very difficult. I'm going to tell you real quickly. People ask me, what is a good eye vitamin? Okay. And I say, you know what? There's no such thing as an eye vitamin. You don't put a vitamin in your mouth. It doesn't go straight to your eye. Okay. There's no knee vitamins. There's no toe vitamins. There's no elbow vitamins. Okay. What we need to do is we need to take a look at you and your body and see what you're missing and put you on the right supplements, right? In the right form, because it has to be bioavailable from a good source, right? And in the right amount. So we can do so much better than a preformed one size fits all ARES vitamin. Then that we really have to get beyond that.
Mm-hmm. Okay. Maybe we can just take, it's about wrapped. So thanks just for the general conversation. I'd like to take some questions from our live audience here, and we'll just take them in order and they came. You good with that, Scott? And if you can see the questions, I could tee them up here. Can you speak about ocular migraines? Is that something that you treat? Have you ever helped a case of ocular migraines?
Yeah. Quite often, yeah. So ocular migraines, it's interesting because again, it's an underlying general health problem that has causes, okay, and it shows up in the eye. So often ocular migraines, they're not even the eye is really just a warning flag that something else is going on, okay, and they're typically vascular in nature, having to do with either blood pressure or blood sugar, other types of general health conditions, and they end up with visual aura and symptoms in the eye, okay? And even patients will tell me, I'm having one right now. Should I come and rush in there so you can look in my eye? Like as if inside the eyeball, I'll see fireworks going off in there, and there aren't. That's all assembled at the level of your brain, okay? So ocular migraines, certainly there's things that show up in the eye, but it's an underlying general health condition, often involving hormones and vascular conditions and things like this.
Okay, so that you just said that at the end there it gets a little biochemically complicated. Interesting. Okay. There's a question from Ulrich. What kind of treatments do you use to try to restore visual memory? Is that in your wheelhouse, visual memory?
No, that's something I would definitely turf over to you guys because that's your area.
Yeah.
That's like
so other than
Cognasium, that's you guys.
Yeah, so Ulrich is a famous scientist actually who's asking this question, so that you can't bring your B game when you answer his questions. But the basic answer is, assuming that somebody does not have a lot of neurodegeneration, if there's a lot of degenerative disease, the brain is really shrunk down, it becomes increasingly challenging. But the basics are to practice the visualization in game form, right? And those could be, the Brain HQ has actually a number of games for this, but playing games where you have to quickly and time yourself spotting a difference, remembering sequences, the sequences are pulled away, and then showing them again. Those actually have a lot of data for it, but you also want to fix the biochemistry, right? And then you want to add the energy to the brain, all the things that we're talking about. I think that's the quick and dirty on it. There are other pieces to it, but that's the basics. Bonnie asked, are vision changes an indicator that your brain is declining, or does compromised vision lead to brain decline? I feel like we've answered that pretty good at this point.
Yeah, someone could have a stroke and that results in visual field defects, right? Somebody might have double vision and come in, and I actually tell them that they have, they're a tumor. Okay, so doing visual field testing. So it's both. Sometimes it's the vision piece that I can let them know they have something going on general health, and sometimes they have a general health condition that is going to lead to an eye problem. And again, they share structure and function, and they're inseparable.
They share pathways, we were talking before. Yeah, right. Absolutely. Okay. Inflammation in the brain. How is it determined? You want me to take this one? So inflammation in the brain is hard outside of a research setting. However, we are starting to have blood tests, that can be indicative of this. One is called G fibrillaric acid protein. The other one is called neurofilament light chain. We can do them here in the office. There's a couple of labs nationally and locally. So the big labs that will do them, they do tell us about different things. In order to really have a problem on these labs, there has to be a big problem. But right now, in my view, the value of them is, does somebody have symptoms? Is somebody having cognitive symptoms? And if we get them, what is the trend over time, right? What are the trends over time? But yeah, there are a couple of labs. It's still tricky. There's no perfect way, but there are a couple of blood tests and maybe a couple of other ways to get to that answer, Vine. Or Mary, I'm sorry. Mary wants to know more about brain mapping. I would say just call our office for that one. Brain mapping, basically, in short, is an EEG that's used by neurologists everywhere. I am not a neurologist. I'm board certified in internal medicine. and then in functional medicine. And what we do is we do a standard EEG, and then we feed it to some software. It's also like a machine learning sort of AI kind of thing. And we get what is the brain doing in its resting state? What is it doing when it's just sort of idling, its resting state? And like I was telling you before, one of the things, just an easy example to think about, is when people are not sleeping well, their brain is so much slower. Let's say a normal speed of a brain is between 8 and 12, let's call it miles per hour. Hertz is the term that we use, 8 and 12. I'm seeing people that are like in their 30s and 40s when they're not sleeping well. They're probably normally would be like a 9.5, right square in the middle, nice and normal. When they're not sleeping, it's like an 8. So people can show up, like the professors used to tell you, if you went to college, hey, make sure you get a good night of sleep. Don't stay up and, like stay up all night studying. I mean, the sleep absolutely, positively affects the brain's speed. And then to your point before, Scott, it also turns off a lot of the inflammatory oxidative stress channels, right? Like that's when a lot of the healing happens, is during sleep. And so there's a lot more to say about sleep, but that's the quick and dirty in the brain map. Is it can give us, it's not a perfect test, but it's a pretty interesting test to tell us about the activity of someone's brain in a resting state.
I'll add, Nate, that it's totally non-invasive.
Totally
It's
non-invasive, yeah.
putting a cap on, it's not.
Yeah, we're not putting anything inside. That's up to the point. You don't have to go into an MRI machine or anything. It's just done in our office. Question for you. Are floaters, from this question from Ronnie, are floaters an indicator of any specific brain issue?
No, in general, floaters are pretty normal. It's basically just little clumps of protein floating around inside the eye. The back of the eye is a big ball of fluid. It's not air like a balloon. It's fluid. And it's clear fluid, kind of like gel. And there's proteins that just kind of float around in there, kind of like a lava lamp. So over time, people typically get floaters, and they're very normal. But there are other types of floaters which could be more indicative of like a retinal detachment or some other serious eye problems. But in general, a floater isn't really linked to any specific brain trouble.
Okay,
I tell patients you're allowed to have more than one thing wrong with you. You can have, but they're not related.
Yeah. Okay. So as I have a similar kind of question from an anonymous attendee. This person has iritis, so inflammation of the eye, and they have flares annually, sometimes twice. We have kept the flares under control with methotrexate, which is it's a fairly strong disease modifying agent. But I wonder if I'm more susceptible to dementia because of inflammation in my eyes. I'm not familiar with that this predisposes someone to like an Alzheimer's or anything. Having iritis. Are you? I don't know the answer to that.
Probably not directly, but iritis, is inflammation in the sclera, which is the white part of the eye mostly. And interestingly, the sclera is connective tissue. It's the exact same connective tissue that's found everywhere else in your body. So typically, someone with a connective tissue disorder, arthritis, lupus, or Crohn's, something like this, they have flare-ups in their body, swelling and deswelling and swelling and deswelling, and the white part of the eye will swell and deswell, and that's what breaks those little red blood vessels in the white part of the eye. So they'll have these little bleed outs in their sclera, and it's actually not an eye problem. Again, it's a warning sign something's going on, underlying general health condition that's flaring up and showing up in your eye.
Yeah. Okay. Just a couple more rapid fires. Again, Ulrich, so make sure your answer is prepared and good. For Ulrich, any treatment for regeneration of the retina? Somebody's got two little holes in his left eye retina. Is there any sort of regenerative stuff that can be done?
So there's a lot of different things that people are looking into, and there's some really neat things. I would say in general, nothing that we can get in line for and do tomorrow. But there's a couple of cool areas that I'm looking into. One is light therapy, photobiomodulation, and even that's not new. It's just neglected. But what we're looking at doing is rejuvenating stem cells. I call it stem cell resuscitation. So what we're doing is basically by about age 60, I believe, about 90% of your stem cells go dormant. That's why we get sicker quicker and stay that way longer. So looking into ways of getting stem cells reactivated and having your own body heal itself from within is a pretty interesting area, especially when we're looking at like neural function, retina and brain. And so that's pretty interesting, but there's no surgery that's going to fix like holes in your retina to maybe to fix the hole, but it doesn't restore function. So we can fix structure, but we can't bring the function back. That's the difference between the structure and the function.
Yeah. A couple of questions. I think I'm gonna have to. I apologize, Jason. I think the best way to get your answer so this is a man at if I hope I'm representing this right. CNS lymphoma. Part of it was that he lost vision in one of his eyes. He's one of the longest surviving people in the world, as we understand it. He went to some very big cancer institutes and is just doing remarkably. He was working in our BrainFit program for a long time and did really well with it. But I think he's wondering if there's anything he can do with you. But I think probably the easiest way would be just to have him call your office.
Absolutely. It's at least worth a chat.
Yeah. There's a couple of questions from different directions. Are the services covered by Medicare insurance programs?
So, it's a great question. It's one we get every day, no matter what treatment plan we present. The next question is, does my insurance cover it? And, typically a lot of insurances cover things that I'd rather you not need and hope you never have to get. And so some of the things that we do, especially in the preventive realm of true health care, not sick care, is a lot of it's not covered by standard vision insurance or medical insurances. And so, there is sort of an out-of-pocket cost up front. But I tell my patients, and most of them understand that, believe it or not, 75% of my patients are out of pocket. And a lot of them have insurance, but they opt out of using it to come for the services because it's an investment in your own wellness. You have to understand it like that. You're going to have less doctor visits. You're going to be on less medications. You're going to have less side effects. You're going to have a higher quality of life. And you're going to keep your vision and your mind. Okay, so these are things you may need to pay for if it's that important to you. And if you're going to wait for your insurance to cover those things, then it's probably not going to happen.
Yeah.
Yeah.
Okay. And then Mary Markowski is again asking, is optic neuritis benign or is it generally a warning sign? So optic neuritis, I know in some cases is a warning sign for MS, for multiple sclerosis. Any other things you can think of?
It certainly can be. So you have to rule it out. Look at all of develop a list of what are all the differential diagnoses. What could this possibly be from? And then start to rule them out, and we get to what the actual treatment plan might be. But it could be either one. It could be something very serious or not much we can do about.
Okay, thanks. We're wrapping up here.
Dennis, I'm going to say, if you could go to KemperWellness.com and just put a inquiry in on the website, someone can get back to you with that if you can get a copy of the last one.
Okay, and then Connie is saying hello to you personally, Scott. So you just read the chat there. Hey guys, so we finished in under 40 minutes. Thank you.
Nate, there's a couple of questions in the webinar chat there.
Oh, can past emotional trauma affect the brain? 100% yes. PTSD is a risk factor for Alzheimer's, period.
Yep.
Somebody asking about posterior cortical atrophy. Squiggly lines. So somebody's been to an optometrist, a neurologist. They've been having squiggly lines in their vision when light hits their eyes. Was told their eyes are in perfect condition. You have thoughts on that? I mean, it's kind of it's a hard one to answer.
That's a tough one. Squiggly lines could again be like floaters, and it's something extra that you see in your vision, and there's squiggly lines, and it's merely an optical illusion you perceive something out in front of you that's not really there, and it's something as simple as floaters. Or it actually could be something in your retina. There could be fluid moving in between the layers of your retina, stimulating the light receptors mechanically. Light receptors actually respond to mechanical touch as well as light. And if you actually push on your eye real hard, I can see a purple flash over here, and there's no purple flash. I'm stimulating my retina mechanically. So there could be fluid moving in the retina causing you to see that stuff. So it could be something serious or not.
Okay.
I would say saying it's nothing isn't always a good end. You have to go somewhere else that's going to help you explore it further.
Yeah. Maybe a neuro-ophthalmologist sometimes even. But I just saw a neuro-ophthalmologist probably miss a case of posterior cortical atrophy. So I don't, which is sort of an Alzheimer's-like condition and they said it's probably not that because it's rare. This is a woman in her early 60s. I mean, the whole thing is rare. So I don't know.
It's not rare if it's in your chair, right?
Yeah, right. Right. They would say it's easy to, my pathology professor says, easy to diagnose if you can remember it. That's what it says. It's easy to so this person says, I've been diagnosed with a small drusen in one eye. I was told that there's nothing to do. Wait to see if things get worse. I'm taking all the main supplements as well as many other genetically driven supplements. I follow the RECODE protocol. Is there anything else I can do?
So drusen can be from a couple of different things. I mean, typically you think macular degeneration, but drusen in the macula is
Yeah,
the
she did
macular.
mention she has a couple of macular degeneration diseases. Good point. She mentions that. Yeah.
Yeah, so typically associated with that. And, we can actually prevent macular degeneration. If you already have it, we can certainly stabilize it. And it's even caught that early when you only have like one drusen or two. There's actually a reversibility component where if caught early, we can actually have some of those light receptors that aren't completely dead and gone yet. We can turn them back on and get them working. So there's a bit of visual improvement and then stabilization. So doing nothing in my office is never an option. We don't ever do nothing, have you come back a year later, and then look again. We do everything we can immediately to put a treatment plan in place that's precise and personalized so that we can keep the vision you have and your mind.
Yeah, I would say the same is true here with Kemper. We do, we really, I think we go the extra miles. Nothing's perfect, but we'd really, I think we're efforting to be. So the last question here, we'll just do the last question here. So this is a little bit hard. This is one I actually love to hear your answer on about Parkinson's disease. I have a question regarding brain interpretation of vision with Parkinson's. So, for example, she says, e.g., people on the side of the road are seeing as something totally different. Do you know about vision changes in Parkinson's?
There's a lot of them, and it's like if you've seen one patient with Parkinson's and vision changes, you've seen one because it affects everybody a little bit differently. But I don't really have much to add, like in short time, that's going to be anything significant to that.
Okay. Yeah, and then can anything be done for posterior cortical atrophy? LB answers this. So the answer is we're not sure yet. We've had a couple cases come through our office. We think we've helped to some degree. We've never cured a case of posterior cortical atrophy, but we've definitely uncovered maybe some reasons for it and have helped some people with posterior cortical atrophy. But it's not something I've seen like a total reversal or cure of. Anyways, Stacy or Kristen, is there anything else left? I think we're at 42 minutes and we did pretty good. Hopefully you guys enjoyed this and it was informative. I don't know if you have any final thoughts.
No, I want to say thank you all for coming. This is a very, very interesting topic, and I cannot emphasize enough the importance of the eye-brain connection, honestly. But thank you very much. And if you have any other questions after the event, just go to our website, kemperwellness.com, and submit a web request, and we will get that and get back to you. Thank you very much for joining us.
For having me.
Thank you,
Thanks.
Scott.